Mr. President, I received an email from a doctor, and if I have permission to read, I think the essence, the body of the email kind of says it all.
No objection.
I am a family practice physician in Anchorage. My wife and I started our practice in 1998. In addition to my wife and I, we employ 5 additional family physicians and 2 physician assistants. We care for over 15,000 Alaskans. Blue Cross cut our reimbursement by $40,000 per month last March. In June, Aetna will decrease our payments by 10%. Blue Cross will also decrease reimbursements again this year. Claims to support private primary care providers in Alaska are not working out so well. I am part of a group of primary care physicians in Anchorage and Eagle River that represent over 20 independent primary care providers. We met again this week and discussed the Medicare expansion along with the other bills before this session. We could not understand why elected representatives of tax-paying citizens would support expanding another inefficient government-run program. This one, supposedly designed to provide health care to the needy. In actuality, it would only provide assistance to 10,000 additional Alaskans not already eligible for care under the existing program. No one has asked any of us what we think of Medicaid expansion, not even my patient, a well-placed government bureaucrat. No one asked us what impact the expansions may have on our patients' ability to see their private physicians. Over half of our group of physicians don't have to work. Either they married well or have spouses with jobs they could get by on. We discussed at length with pay cuts to primary care happening already and the proposed physician tax designed to fund the Medicaid expansion. Over half of the physicians said that if this goes through, they'll quit. Most of us refuse to work for large corporations that will insist on certain work schedules, will demand X number of patients seen per hour per day, as happens at the Native Health Center, and eliminate the ability we currently have to adjust the amount of time we deem appropriate for our patients. The expansion is supported by people, institutions, who are positioned to profit by this program. Follow the dollars. Dollars come from somewhere. The promise of federal dollars doesn't mean free money. It's money that you and I pay in ever-increasing taxes. The federal monies are simply a loss leader, an incentive program to bring more individuals into an entitlement program as a stepping stone to socialized medicine. We would do well to take heed to the experience of countries such as Great Britain. When they adopted that model, almost 40% of physicians quit or retired. Alaska's aging medical workforce will probably experience similar stats or worse. The current Medicaid system paid for 5,400 airline tickets for individuals with no medical-related appointments. The source of this came from the Medicaid Reform Advisory Group meeting in 2014. The state Medicaid computer processing program has delayed payments to private physicians for months to a year or more. A single Medicaid patient had over 250 physical therapy appointments in 1 year. Does anyone really believe that a government-run program is going to efficiently provide individual health care to Alaskans? And finally, do not expand an already inefficient problem-plagued program. Follow the money, and you'll find that the ardent supporters of this measure all stand to gain something at the taxpayer's expense. And it's signed John and Miriam Nolte, MDs, Anchorage, Alaska. Mr. President, the only reason I read that is, A, I think it brings a different perspective, and B, there's still a number of us that want to help Alaskans. There's still a number of us that believe that all Alaskans should have access to great health care. We just don't know yet what this vision of Medicaid expansion will look like. This is just another side of what some folks think it may look like, and in some respects, what it already does look like. Thank you.